Happy Pride Month, everyone.
Happy Pride Month. So we are planning to start these lives regularly, and we start with the Diva first. So we will talk about the Pride Month, the celebrations, especially so huge in the UK, right?
Yeah, massive. London Pride, I think last year was 1.2 million.
Yeah, they are
It's
leading this.
huge.
Yeah, also Manchester Pride,
Yeah. I haven't been to Manchester Pride,
right?
but yeah, there's loads all around the country.
Oh,
It's
that's
really cool.
great. So, about the Pride Month, the London is first. I know that. Where to go? Which one celebrates very well?
Yeah, well, I think everyone goes to Pride. Like people, when they come out, go to Pride, tend to dress up, have fun, meet new people. But it is so busy. Like it's possibly the busiest day you'll find in London, and they'll close off the roads all the way through Central, and there's different like bands and shows going on everywhere.
It's been like a carnival.
Huge festival, yeah.
Yeah,
Like
the
a big,
huge festival.
Yeah.
Yeah.
But it gets messy, and a lot of people tend to congregate into Soho at the end, and you're kind of wading through like rubbish and people. It's just like a huge festival. The place gets trashed.
Hope I would be in London for next one next
Yeah.
year. Why not?
Yeah.
Right? Yeah, that would be great.
Yeah.
So, what about your journey? What we did?
Wow. Yeah. So my journey, I feel like, so I literally, I came out when I was 38. And it's a bit of a strange story because I didn't really know what trans was. I was self-medicating off the internet without any medical supervision because I was scared. I didn't want to tell the doctors. And sort of have it on my record or for anyone to know. So to tell a doctor would be even worse. But I didn't actually know what it was. And I was doing it for years before realizing what it was. And I ended up Googling it, and that was just like a wormhole. So I went to counselling. Still didn't believe it. But basically they said to me, well, if you want to change your body and you're taking hormones, that's not something a straight person would do. You know, this is something you want.
Yeah, but
Clearly, my choice.
But that's important point because that's your life, your body. You don't want to share with anybody, but you have to consultate with some specialist actually.
Yeah.
So sometimes that's being hard, like if you are not that talkative.
Yeah.
So, but it's essential if you have a medication to ask somebody specialize it.
Yeah. I was, and I wasn't doing it properly. And if you don't do it properly, you don't really get the sort of outcomes that you want. So eventually I went to sort of gender GP, and then I started doing the hormone process properly.
They're good. Yeah, good organization, especially for beginners.
Yeah. And, in the UK, the waiting list is like 7 years just to get your first meeting. So if you can't go private, you're really in a tough situation. And that's really sad. But so being able to self-medicate is a thing. But how they, because of financial situation and the lack of sort of support from in the UK. But if you can access medical care, it's definitely better, and you'll get the sort of results that you really want.
Actually, this is important to, as we talk, like an example, Pride Month, the joining festivals is important because in the beginning, it would be hard to share with anybody. So if you join somewhere, like even if I go to Pride Month celebrations, no one would say why you are here to me or why they ask about my sexuality, right? So it's just like a public festival actually. So let's say please join some organizations if you think that you are transgender and you're looking for hormone therapy or surgeries, just be talkative or just try to join anything. So
Yeah.
that would be after you share something, you'd be much more brave to hold your life.
Yeah.
That would be actually would be wonderful to not get lost, basically, because all the time that I think about people that wants to change their reality, their life, their sexuality, everything, they're being getting lost. And if you don't touch their lives, so it would be problematic because they are being open to violence. That's the problem of society actually today. And it's essential to join some organizations. Even like Gender GP, they called me time ago, maybe a year or years, after they have seen my work. So they want to get contact. It was so kind. And we talked with the manager. So then they asked me to, even all over the world, not from the UK, if the patients are looking for some support about like Gender GP, so they called that, please direct us. We would be loved like to help anybody all over the world. Just would need to speak English, or otherwise, even not, we would try to find some translator in UK.
Yeah.
That's actually so kind, so so helpful also, because in Turkish we say come and be familiar. You know, possibly if any literature lovers know, the Yunus Emre is a great poet in Turkish history, in Anatolia's history actually. And even when I was in Oxford, I was seeing some statues like him and talking about his literature. So come and be familiar is a great proverb actually for this, because if you stay within your corner, I know when you want to change something, it's being hard to join people, but just join. You don't need to share anything about your thinking, about your mind. Just say hi. So it would be preserving against to get lost actually. To Pride Month, I think that would be the best message to change people's lives and being helpful about it.
Yeah, it does. It brings people together, and community is so important, especially when you're not sure what things are. The internet's great, but you can't Google real sort of interaction with people. So yeah, absolutely finding community. I mean, in the UK we have Meetup. The London Transgender Meetup's fantastic. I think there's 1,000 members now. But if you go on Meetup, any sort of anything in the LGBT community, you'll find thousands of people in any group, or even small groups. Yeah, and that is definitely something, because you think you're the only person, and this is completely unique, and then you actually find out afterwards, once you've reached out and you've met some community that actually were very, very similar. Yeah, it's very interesting.
Yeah, that's great. That's great. I hope next year I'll be there.
Yeah.
And that would be great right now. So about the surgeries that we done, you want to share?
Yeah. So, oh my God. So the first one was 7 months ago. You did FFS for me. But what that was a combination of maybe 8 procedures in one go, maybe more.
Yeah, around that.
There was jaw, forehead, nose, soft tissue stuff. How do you say it? Cantiloplasty? Cat
eyes.
Yeah.
Actually, I want to explain this because when we say cat eyes, there's been fox eyes, hunter eyes, almond eyes, brow lift, temple lift, eye lift. So it's being confusing. Basically, all of these are the combination of the temple areas lift. What we say for cat eyes, it includes the brow arch, tail, temple, and eye.
Yeah.
And if it's not including the arch, we say fox eyes. If it's only eye lift, we say almond eyes. But basically, we would be upgrade the degree and the area according to patient's expectations and anatomy. So we don't have to do cat eyes for all, but we say in the end cat eyes. Then the patient comes here within the face-to-face consultation. I ask within every part and like manipulate and ask how do you look and what's my recommendations. So then in example, to perform Fox eyes, I do surgical release right here and lift it. If I want to do it as a cat eyes, I release this part and lift also. So if there is asymmetries, it's able to match the symmetry. And also it's able to do like so exaggerated or keep it as natural as it is. Or we would need to also watch after about the gravity takes down within the first 2 months. As you know, like I do it exaggerated, but within a few months it would be normalized because no one can stay after gravity.
Yeah, it's totally worth it. Like that is one of my favorite things. And obviously like the shaping I love, but you know, of the bone work. But without the actual sort of rejuvenation of technically a facelift as well. And the sort of the whole overall sort of rejuvenation is really, really amazing. Because, I mean, one thing about coming out and transitioning later in life is you kind of want to have another go. you want to be able to do. I wanted to be able to do my 30s again and sort of enjoy that sort of life. So having, you know, it's quite a difficult surgery. You know, you've got to be prepared for it. Like, you know, you should do your research. It takes 3-4 days of like real relaxation and doing nothing and just passing through time as the swelling gets worse and then slowly goes again. And then it's like 2 months before you start seeing what the final results may even closely be. But one thing which I never thought would be possible is I would never be misgendered again. So I don't know if we're going to put some of my like old photos up here, but I was a middle-aged white businessman. Right. So, and then I went sort of right through hormone process for like maybe properly for like 2 years before the surgery. And that softens you up a bit, and you know your point of view on things and what you engage with changes, but you're still viewed in a way that doesn't really let you assimilate into sort of straight culture, where you know if that's what you want to do, and you know not everyone does want to, but if you want to be sort of like passing and living in that sort of world, really I think this surgery is fabulous for that. I mean, I woke up from the surgery and I was sick. I couldn't see. I had to be looked after really intensively and to stay on top of the pain. But as soon as I could open my eyes and go for a walk, I was never misgendered again, even though I looked like a potato. There was a female potato. And at that point, I didn't care. I was like, that worked. And ever since then, the results have been getting better and better and better. And you've changed my life. And yeah, I don't cry in the mirror. I used to cry in the mirror every fucking day. Sorry. Every bleep day. That's painful. That's real painful. And that's gone.
Yeah, it's like,
there's nothing else
as I say, breaking the cage, right?
Yeah.
Someone just jails you into a statue that you want to be, like a cage, and then you break the cage, then you meet with yourself again in the mirror. So basically, I think that's one of the top reasons that I do this work, because sometimes they say it's like a recreation, but I think I would have a problem with big guy if I say that. So let's say the reaching out for your female-born sister. So it's like an imitation work of the God. We're just imitating, but in the end, the happiness is precious because you just match out with yourself in the mirror. And the other reason that I do FFS, guiding points actually, because you get into the surgery and you would need to imagine actual female-born twin, because bone, you change the jaw, cheeks, nose. So in example, when we do the simple nose, there are guiding points. Actually, we just orientate it and improve the facial harmony basically. So then the problem would be solved. But for the FFS, no guiding. And actually, there are no books has written about this, because even the big guys' work has no books about this. You just try to understand what is beauty and try to imitate this. But God, in the end, after the hours of work and face especially is being hard, especially for jaw work, you start to get your dietary with straw, and it would be so restricted, like water and some juices.
Yeah.
After a few days, but when you see, as you mentioned, the swelling starts shrinking. So, God, it's worth that, right?
Yeah.
So it's been really big happiness for the surgeon, for the patient, and sometimes after, like, we have a busy day, a lot of checkups of patients. An example, I did, like, for some months I do like 10 or more full FFS and some single, double or triple procedures. So in a normal week, like an example, in Monday we have 7 checkups of patients for 2 weeks. So after, there are a lot of people is crying with the mirror about the happiness. So after evening, everything every done has gone off the hotel. The team starts to get crying because they see the real happiness. As a surgeon, I know something about this, yes, but after they start to work with me after a few weeks, and when they see the real happiness within the eyes,
Yeah.
so then they start to understand what is transgender basically. Because in the beginning, people have no idea about why they are changing your visualities. They don't have nothing. They have nothing. That's why actually people is being like violent against transgender people, because they're not familiar. They don't understand what is going on. They just get scared because they don't know what's happening about the transgender people, psychology about life, why they want to change their visuality. They have nothing, no knowledge. But when the people improve this, so they start to get understand. Even I cannot understand about your adventure, but I just know what is matter for you, like FFS surgery or any other surgeries. So thank you for your kind words. I'm honored.
Yeah. Oh, it's really nice. I mean, I've come back here 2 times since the FFS. This is like, I like being here. It's a luxury. Every time I come, it gets better as well. Like,
Also, you like stem cell cocktails, right? Nano-fat grafting.
Yeah.
Also, you love this effect.
So I was in the hotel last night, and I went to this hotel sort of close into Central, and it was there was a lot of British tourists here having their teeth done. So they made this sort of like WhatsApp group. Is like, so what are you having done? What are you having done? What are you having done? So they ended up calling me over, and they're all getting drunk by the pool, and they're all like comparing different whitenesses of teeth and stuff, and having a great time. But then they're like, so what did you do? I said, oh, well, I had some, this time I had some lipo filling in here and some stem cells. But they don't know I'm transgender. And I'm like, I don't want to tell them because there's like 20 people, and then it's going to turn into like 50 questions. And I just want to chill by the pool and have some food, and yeah, it's nice to socialize.
Not necessary.
But they were saying, so how old are you? And I said, I'm 40. And they're like, no. I'm like, why is it? Yeah, go get these stem cells. They're good. It takes some time. I don't know how much. So yeah, I've done hyaluronic filler, Botox, the Syneos, all the Juvederm type stuff, loads of injections, spent thousands, probably as much almost as the actual FFS on beauty therapy. And it's all temporary. It doesn't really last that long. To actually get results, there's a lot of stuff out there on the market it might last a little bit. I've done the PRP microneedling, I've done so many things.
Yeah, less application, lasts longer.
But this compared to PRP, I mean, PRP, they take your blood, don't they?
It's kind of like remnants of stem cells, PRP, but this is actual stem cells, actually. That's why I call it as a cocktail, because I just extract 10 or 20 cc's of tummy fat or fat around somewhere. So then progress it into a cocktail, because fat tissue contains 4 times more than bone marrow. So, of course, it's maybe 100 times more than blood itself. So that's why it's easier to find as a donor area, easier to progress, and no donor area complications, almost not. So that's why a fat tissue derived cell cocktail is being the most highly cost effective for today. And I have a lot like scientific articles within prestigious plastic surgery journals. So it's about mostly how to improve effect or potentiality of stem cells, like fat graft survival, in example. So stem cells matters, but that's what more matters, because we would need to have it more cost effectively, less donor area deformity, because days or weeks of laboratory work to wait the actual stem cell cocktail, it's being so much. Like, you're coming from Britain and you would have your stem cell cocktail, and then a few days later you can go off.
Yeah.
But otherwise, you'd need to be here for a few days or laboratory work. And what's for a fact, like this stem cell, I'd say 7 or 8 out of 10. And that laboratory work within high costs would give an effect of 10 out of 10. So it doesn't worth for it, as I have seen. So it's being easily, you have your application and then chill out the poolside.
Yeah.
So it's being much better. And also, one of main questions when we start to talk, I just reminded. So when I recommend forehead job and jaw work and nose all together, like a complete FFS. Some of patients ask, isn't that too much for one shot? Actually, as you mentioned, around maybe 8 procedures we have done within same day. So within the newly improved high developed facilities, plastic surgery knowledge, anesthesiology knowledge, like general anesthesia. So today, it's not counted as a long surgery for 6 or 7, 8 hours actually. And it's being similar to get well after surgery. Like simple nose surgery, it takes 2-3 days. And full FFS, also it takes 2-3 days to get the swelling, beginning of shrinking of it, and like having a taste again and getting feel rest again. So it takes few days when compared to FFS, like 8 hours or 7 hours or 2 hours of nose surgery. It affects similarly just after the surgery. So that's why today we recommend full FFS in one shot actually. But in example, if the patient asks like full forehead work, cheek, nose, jaw, trachea, and breast, so I say let's split it into 2 because it wouldn't be maybe too much for a surgery. It would be too much for healing actually after surgery, because your body has some potentiality to heal it. And if you go more over it, so it would be hard to get healed soon. So that's why basically full FFS for today is not too much actually. I just want to clarify this.
You get results as well. Like, I did go to several other surgeons. The one I was actually booked in with went out of business, which was LTC in London. And I went back to facial team. See, and the cost had gone up to like 45,000, and they were only going to take like 2 millimeters off my jaw. And they did this sort of graphical representation, which I didn't really like either. And I was like, man. And I also did a lot of research on the internet, and people had shown before the graphical representation and after, and it didn't really match anyway. And also your face is dynamic. You don't see the different angles, the different expressions and emotions that you portray. So I think there's a lot of it. Like, I had no clue what the outcome would be. I still don't think it's finally, we're 7 months there since the surgery, and I still feel like it's changing. I still feel like shape is kind of changing a little bit. There's improvements all the time. There's just a lot of you want to change something and it's not right and you're not too sure, but you're kind of in the dark. When your face matches what you want it to be, it's like the light is turned on, but you have to kind of take that leap. You've got to want it to be different enough to not care that you don't care what you have, because it just doesn't work for you. So to explain that to a trans person, they're going to understand it, but to explain it to someone who isn't trans, well, why don't you just get a nose job, or why do you need to change anything? But it's so personal that and when you've gone through this process, your life actually changes. The way you're treated changes. It's definitely worth doing. But also, there's also quite a lot of things in society that aren't necessarily great. Like femininity and age and beauty, and there's a lot of pressure on girls to look a certain way and to look young and all that sort of stuff. And transgender people feel it as well. And I suppose it's also even worse, because then you'll be trying to do something, trying to convey, be treated a certain way and look a certain way, but then people will come to you and misgender you, or make you feel othered, different. And you don't really want that every day.
Yeah.
So doing these surgeries releases you from that shackle. It gives you more opportunity. It just releases your life, basically. It takes you out of a holding tank and out of a darkness. Which can affect your whole life and how you feel about everything, make everything harder, because you're just not happy, you're depressed, essentially.
Yeah, actually, you're stuck within a body, so, yeah.
Yeah.
Well, let's finish before we cry. It was great, thank you so much. When we start to talk this journey and how it matters for transgender people, how change lives, actually it's being so sensitive, a lot of feelings about that, because it's being kind of justice, freeing people. Actually, there are a lot of people gets annoyed to God because of injustice all over the world. So you're being like a finger of the God, and the real justice comes out of the patient. because they would be released, they would be free. So it feels a lot. We cannot just stuck out into the one podcast maybe, but even with the stories of people, when you listen this and record this, I just planning to, maybe with their permission, writing a book like few years later about the stories of patients. I have a lot, like uh, barely saved her life from Saudi Arabia. A patient now lives in New Zealand, because otherwise they would be jailing her, and the finish wouldn't be so great. So they have bad plans for her. A lot of stories all over the world, and unfortunately, even the Western world, or even the best country, is not that friendly for community yet. So like, these feelings and stories matters actually, to not to get lost. And after FFS, when I see that happiness, it worth everything, I think.
Yeah, it's true. I mean, there's some real tough places in the world, even in the best countries, like you say.
Unfortunately.
But, you know, a country or a community or a society that victimizes vulnerable people needs to take a look at itself and the direction it's taking, and what it wants for its children, and what it wants for, you know, the future of the country. Because just one vulnerable, victimized group this year can be another one next year.
Yeah, that's actually one side of problems of humanity, and it's not about only gender. It's also about race, religion, everything.
Yeah.
It's quite being like staying against the fascism. So that's why I like to do facial feminization, top surgery, body surgeries, even for masculinization and feminization, because it's being standing against the fascism. Because actually, that's why I think, in example, that children might be having the like generosity of Einstein. If you just victimize her or him just because of the gender choose or any other race, so it would be loss of the whole world actually, because that's not justice. It's just think about it, because of what you choose, and that's not harmful for anybody. That's what you choose about your gender, anything, or the dress that you have. You want to have a dress, red dress, right?
Yeah.
But people get annoyed for it. But actually, that's the problem of their eye, because you can get dressed anything what you want, no restrictions. Of course, there are society norms, but not for stuck anybody. So that's feeling kind of having a justice and standing against the fascism of people, because that's how civilization improves. That's how we become human. Otherwise, like, animals are being better than us otherwise, right? So yeah, thank you for your joining
you.
us. And
Thank you so much.
my pleasure. I'm honored. Thank you. Yeah, let's finish before we cry.
Bye, everyone.
Bye bye. Thank you.